We've all felt it. That slight pressure in your gut after a heavy meal. A dull ache that comes and goes, leaving you feeling just a little off. Most of the time, our brains are hardwired to tune out this biological background noise. We dismiss the discomfort, grab an antacid, and get back to our day. With pancreatic cancer, the first warning signs are often this subtle, barely perceptible ripples, hinting at a larger issue deep inside. Looking at a map of the torso, past the stomach and liver, sits the pancreas. Buried deep inside, dangerous abnormalities can grow entirely in the dark, with no visible lumps or anything you can feel through the abdominal wall. Because the organ remains hidden from physical examination, identifying a problem requires paying attention to the secondary signals it sends to the rest of the body. The earliest signals are often the easiest to rationalize. The process usually begins with a vague, dull pain, originating in the upper abdomen. Looking at this side view cross-section, you can see how close the pancreas sits to the spine. As localized pressure builds in the abdomen, that pain frequently radiates backward, traveling directly into the lower spine. Patients notice this discomfort acting up based on specific behaviors, often flaring up immediately after eating a meal or when they lie down flat in bed. To understand the next set of alarms, we have to look at what this organ actually does. This abstract schematic shows the pancreas acting as a digestive factory, releasing enzymes that dismantle food into usable energy. When a tumor disrupts this, the body loses its ability to extract calories from food, resulting in rapid weight loss. You might also experience a sudden drop in appetite or feel completely full after eating just a few small bites. These early, functional symptoms mimic a stubborn stomach bug or the general digestive changes that come with age, often causing people to delay a trip to the doctor. When the disease progresses, it often triggers systemic failures that are impossible to ignore, much like this heavy amber fluid permeating a clean membrane. The primary visual alarm is jaundice. This is when the skin and the whites of the eyes take on a distinct yellow tint. This diagram outlines the plumbing malfunction behind that yellowing. A mass forming near the head of the pancreas creates a physical bottleneck in the adjacent bile duct, causing bile to rapidly back up. As that bile enters the bloodstream and filters through the kidneys, it turns urine a dark tea-colored amber. At the same time, because that bile is blocked from reaching your digestive tract, stools often become noticeably pale or clay-colored. While a mild stomachache might be monitored at home, these systemic visual changes signify a mechanical blockage that requires immediate medical evaluation. Before you worry over a recent bout of indigestion, there is a critical piece of medical context to keep in mind. Having one or more of these symptoms does not automatically mean you have pancreatic cancer. Common conditions like gallstones, painful stomach ulcers, or basic digestive inflammation frequently trigger these exact same warning signs. So when should you seek a professional? Doctors look for 3 specific criteria: symptoms that persist over time, symptoms that become unusually severe, or symptoms that occur together. A medical evaluation is the only way to see past these overlapping symptoms, pinpoint the exact cause through professional imaging, and begin treatment if necessary. Because the pancreas is positioned where it is, paying attention to these signals is your most effective defense. Your health is too important to leave to chance. For more information on wellness and prevention, follow Wellness Secrets.